What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video will cover the best things of being an X-ray tech. So to give you context, I'm a night shift tech. I do X-rays at night and at ER, trauma 3, work 7 on, 7 off, and I work a lot of overtime, so I do dabble in day shift. So one of the most beautiful things that I would say is my lady's a nurse. And I have a lot of family member who dabbles in different parts of the medical field, both in radiology, both in the other aspects of the healthcare. And I would say is that every time we congregate and talk about our jobs, I am the only one who kind of likes their job. And my job is sometimes hard, but I can't complain about it because I have it better than other people, because their job is so stressful and so like hands-on and a lot of liability and stuff. So like my job is like kind of that sweet spot, something like that cool kid type situation where like I'm in the medical field, but I'm not liable for a lot of things, and my job's semi-easy if you get a routine and you kind of build your craft at it. And they only need you for certain times, and like I spend a lot of time, especially at night, chilling, and I'm still getting paid money compared to other, like my lady's a nurse. The whole time she's working, like, and like we'll talk, and the whole time she's like, damn, I wish I would have done what you did. It would have been way easier on me. And like I even with the night shift, I make more money than her. Yes, if you work night shift and you're a nurse, you'll make more, but essentially right now I'm holding up pretty good gig. Like it's good, like especially at night. There's time where you just be chilling. Like it doesn't have that much in day shift because you have a bunch of stuff going on, but at nighttime, if it's slow occasionally, there'll be times. The best set of 7 I've had, 7 on, 7 off, the most golden era I've had was for 7 days. We had like the best ER doctor we have, where he doesn't order no bull, just straight business, straight what he needs, just the goat. And it was just slow. So like every single day we would essentially maybe do like 3 to 4 chest x-rays, and then the morning port would show up and it would be like 5 or 10 morning ports. Essentially, I did the calculations of out of the 12-hour shift, maybe only 2 or 3 hours of work. And the rest of the time, straight chilling. Nothing. Just sitting there. And one of those nights, my other tech, we would take turns. He would be napping. And I'd stay awake just in case they would order something. As long as like one tech's awake, you can kind of alternate. Take your own. Can't confirm or deny. But like Netflix, YouTube, like whatever. Do this when I'm doing like other stuff. Like it has their own little crafts. So that's something that no one else really can do it like that. Because like nursing, like even if there's stuff ordered, I'll shoot it, and then I'm kind of essentially, unless this patient gets bad or breaks or they find something, I don't have to deal with the patient again. Compared to like if you're a nurse, you constantly have to be checking and doing like this whole shebang of treatment and stuff. And my respects to them, because my lady's one. But it's kind of pretty cool. The work is like, majority of our work is like a chest x-ray, which is the bread and butter. If it's a one view, 30 seconds in and out. If you clip it, maybe a minute of work. And then it's like, you chill. Like it's a really good gig. As soon as I figured out, like even documentation and all that, you literally will copy and paste whatever the doctor says as far as the order reasoning. You just paste it, and then maybe depending on if the patient wasn't able to exactly get the best images, like there's pain involved, why you couldn't, or the pictures weren't optimal, you just a little bit of documentation, and that's about it. You don't have to really go into detail and stuff, and occasionally like change orders because they ordered the wrong one or stuff like that. But it is a very good gig. Like I would say, if you want to get your foot in the medical field but you don't want to be having high liability and not be as stressed. Of course, we have our moments where we have high end stress, where I call it the money shot, where like the patient's dying, you only have one one opportunity to get that X-ray before they start coding, before like everyone gets in the room because of radiation, like people back off and stuff. So occasionally there is high level of stress, and you just have to be skilled, and those moments is where your skills of years kind of shine. So I would say it's a very good gig. I am thankful that this is what I do, and here I am sharing with y'all the knowledge. I know out of all the fields, I know YouTube, if you go to YouTube, nursing has an ungodly amount of videos. No one does X-ray videos in depth like I'm going to. I will cover every single aspect of this field, because when I was a student, no one would, like, there'd be videos that'd be out of date, and then occasionally, a day in the life of X-ray, or what I do, what is X-ray, like basic stuff, but they never would go into the nitty gritty. I would always be curious about certain aspects, or something would happen in clinicals and I would be curious and I would Google it and there'd be nothing. Well, the internet got to me now. I will be giving y'all the knowledge, the sauce, every single aspect of this job that I can legally give, because there's certain stuff you can't speak about because it could hurt your like reputation or your job and stuff. Certain stuff you have to keep protected because of. But besides that, I'm giving y'all all knowledge. This is for free. I will always do this for free. There's no paywall. There never be. This is just me giving back, giving y'all the knowledge. I will always keep you honest. Keep it. Like, there's so much stuff in our field that I feel that no one talks about, or they do talk about, but as a masses, it's because we're a subset of the department. Of the medical field as a whole is mainly composed of like the doctors, the nurses, and then all the other fields are kind of like their own little tiny subsections. Even within the radiology department, we're kind of still pushed at the very bottom. Even though we're at the kind of like the base entry of radiology, because of the level of importance or how the hospital views, we're still more pushed down lower. And even I've noticed that certain, like, even like to get into the field, there's less chance for students. Like, there's less, I guess, equipment. There's less, like, nursing students, they'll accept like 50 to 60, my lady would say, and then maybe they would trickle down all the way to 20 at the end. And ours, like, our program, it was like, some are like between 15 to 20. That's it. And like X-ray in general isn't even available, not in all the areas, like in all college compared to like nursing and stuff. So I'm here for y'all, giving y'all the knowledge, giving y'all the sauce. And trust me, I will do every little aspect of it. And I will be essentially posting videos a lot. And once again, they'll be from various subjects, both from you don't know what X-ray is all the way to you're already X-ray tech and you need like all aspects. So yeah, it's gonna get good. See you on the next one.